Yep. Good afternoon. Welcome to day 307 at the EMA office, where we're bringing you the latest numbers on the COVID. Chairman Kern and Sam Behrman. It's Thursday, I believe.
I think I ask myself that question every day.
Every day.
What day is it today? So as of today, 229,583 St. Clair County residents have been tested, which is an increase of 2,124 from yesterday. We are at 23,809 positive test results, which is an increase of 161 from yesterday. And that does include both males and females from under the age of 1 up to their 90s. And today our daily county positivity rate is 7.6%. And we are at 205,774 negative test results. Unfortunately, we are announcing 2 additional deaths today, which does bring our total for St. Clair County to 369. We had 1 female in her 80s who had underlying health conditions and a male in his 70s with unknown health conditions. And as always, our sympathies go out to their families. For those who have completed the IDPH required 10-day isolation period, we are at 21,332. For state totals, 14,457,620 have been tested. And we have 1,052,682 positive test results, which is an increase of 6,652 from yesterday. And for deaths, the state is reporting 17,982, which is an increase of 88 from yesterday. For St. Clair County hospitals, we have 95 patients that are currently admitted due to COVID-related reasons, and 12 of them are on ventilators. Regionally, we have 176 patients that are admitted due to COVID-related reasons, and 17 of them are on ventilators. For our long-term care facilities that are currently or previously been in outbreak status, these are cumulative numbers, and we will only announce any facilities that have had changes. Cambridge House of Swansea has 24 cases and no deaths, and that is an increase of 2 cases for that facility. And Four Fountains has 148 cases and 29 deaths, and that is an increase of 2 cases for that facility. For tomorrow, January 15th, and Monday, January 18th, we will not have testing at our 330 West Main location. We are preparing to start our vaccination process, so we will not have any testing at either one of those days at that location, but all of the remaining locations in St. Clair County will still be up and running. And I will turn it over to Chairman Kern for his update.
Thank you, Sam. We'll move into the zip code report. 62201 is up 3 to 492. 62203 down 1 today to 535. 62204 is down 2 to 347. 62205 is up 4 to 551. 62206 is up 3 today to 1,089. 62207 is up 1 to 504. 62208 up 8 to 1,332. 62220 up 11 to 1,624. 62221 up 22 to 2,287. 62223 up 10 to 1,425. 62226 up 18 to 2,593. 62232 up 7 to 764. 62239 up 3 to 381. 62240 is up 1 to 122. 62243 up 7 to 619. 62254 up 5 to 676. 62255 up 1 to 61. 62257 up 4 to 267. 62258 up 15 today to 854. 62260 up 6 to 614. 62264 up 5 to 286. 62269 up 27 to 2,673. And 62285 up 4 to 449. Pretty good numbers today, relatively. 161 new positives, 2,124 people tested, brings our daily county positivity down today to 7.6%. We haven't seen that number for some time. That brings our 7-day rolling average down to 12.1%. And then our regional positivity today is also down to 10.3%. And that's the key number when the state looks at this region for reopening, and we'll talk about that in just a minute. But that number is derived by Bond County being at 12.3%, Clinton at 4.5%, Madison 10.9%, Monroe 11.5%, 11.3%, Randolph 8.8%, St. Clair is 10.1%, and Washington County comes in today at 9.7%. So, Herb, I received a call from Wendy File at the Chamber of Commerce today, and a number of interested people about when are the regions going to reopen, what's necessary. So, Herb, you helped me out, and we kind of went through the numbers with Brian. So, if we are allowed to go back, and that would be to phase 2, what really that allows the reopening of indoor gaming, of theaters, some indoor recreation, but not really the major interactive recreation, but a certain amount of indoor recreation would be allowed to open. We have to be below the 6.5% level positivity if we're to start to reopen the restaurants and the bars and the other things that we normally think about as part of a reopening process. So that being said, 12% is the level to get to another level, reopening level. Several of the regions in the state will be reopening to that level. We believe tomorrow. It looks like their numbers are meeting that. So there are 4 metrics that the state looks at. And the first is the positivity rate, the regional positivity rate, and that has to be below 12% for a period of 3 days. So we've been there. We are at 10.3%, so we are okay on that first metric. But the next 3 metrics, we don't meet any of them. So the first is ICU availability. We are at 15.3% of ICU beds that are available today. That number needs to be above 20% availability for 3 consecutive days. So right now we're at 15.3. We have to get 20 or above for 3 consecutive days, and then we will meet that second metric. The third metric is med-surg bed availability. Today we're only at 12.2% availability of the med-surg beds. That number also needs to be at 20% for 3 consecutive days. So we have a way to go to get med-surg beds for 3 consecutive days of 20% or above. The fourth metric, which we also don't meet, you have to have 7 of 10 days decreasing regional hospitalizations. And remember, the state runs about 3 days behind us on our numbers that we report, because we try to get you, the earliest, most up-to-date numbers, and we crunch them. The state puts them in the system, and they look at them a little bit later than we do. So remember, they're 3 days behind. But currently, you have to be 7 of 10 days decreasing hospitalizations. And right now, according to the state, we've got 5 of the last 10 days we've been increasing. So we got to turn those 3 metrics around, and then we can open up a little bit, but still it will only be back to indoor gaming, theaters, and a little bit of indoor recreation.
Well, and we need more days like today. If you look, the operative word today is down. All of our categories were down. The hospitalizations went down. Our county positivity, the 7-day rolling, as you said. So those are the kind of days that we need to see moving forward here.
We're in a trend.
Yes.
We are trending downward, but we've got to continue to do. We're trending downward because Team St. Clair's out there doing the right things. And now that the vaccine is happening, and I think we're going to be talking in a little more detail later on this week about how many vaccines we have and who we vaccinated and where we're going with those numbers, to give a little bit of an idea as to when we'll get to 1B. and that'll be coming a little later on this week. The vaccine is certainly the light at the end of this long tunnel, but right now, the way we handle it is masks and washing your hands, staying out of crowds if you can, and watch your social distance.
Well, that's the one thing we have been talking about is the vaccine. And as we said yesterday and a few days before, the health department is working daily. By the minute, it's changing. We've said all along, getting the vaccine into county is the big $64,000 question. Doing the logistics on getting that, getting the scheduling. I know last night we were late. People were calling. We were still signing them up on the form that's available. And still trying to do the testing. That reminds me, this Saturday, Sam, I think we have testing at the Marissa Village Hall.
Yes, we do.
8 to 4.
8 to 4.
So you folks in Marissa, take advantage of that, 8 to 4 at the Marissa City Hall. Go out and get tested. But yeah, if we can continue this trend, and again, we keep saying it, we're all tired, we're all stressed, but we're close, and we just got to keep going. We're getting into the vaccine stage here, and I know Sam and Mila and everybody is just working hard to make sure that this thing gets done right. We want it to be a smooth transition. That's the other thing. We're getting a lot of calls of people saying that they saw on the social media or they saw on the news that places are open up to start doing 1B as early as Monday. But if you research it a little bit further, those are for places that have completed 1A. Am I right, Sam?
That's correct. That is correct.
And 1A are your hospitals, your medical personnel, and then a lot of the doctor's office, the dentist's office. And we just have a lot of those in St. Clair County. And so while we're administering vaccine and we've got a lot of doses that have come here, we're not to the point where we have substantially met the demand for 1A. And therefore, we can't move into 1B until we make that happen. The way it happens is we need more vaccine, and we need to get that vaccine in the arms of people in 1A to a level where the state then allows us to move into 1B, which is the goal.
Well, and as Sam said, they were doing some vaccination today, get some tomorrow. So you're doing the 1A as much as the product you have available.
Correct.
So for those of you who have been calling and sending messages that, hey, when can I come and get my shot? I'm in category 1B. That is the purpose of signing up on that form, either here on the EMA page or on the health department page or on the county website. Once that product gets here, the vaccine gets here, when they get to that 1B, the category that you fall in, you'll be getting notification to schedule your appointment, and then at that time you'll be told which site to go to get your shot. Believe me, we want to get it in your arm as quick as you want it. So Sam's ready for a vacation, I know. We all are. And we know you're tired of hearing us for 307 days, but believe me, Team St. Clair, we appreciate each and everything you do. Spreading the word, helping share that farm. I've had a lot of calls today from people just needing help doing it. If you need any help, you can call here at EMA. We'll make sure that somebody can help you work your way through it. It's a real simple form to fill out. Takes just a couple of minutes. Just basic information that is maintained at the health department, and it's our way of being able to notify you as quickly as possible to make your appointment so we can get that vaccine in your arm and we can start getting back to normal. So
Can I interject for
you
1
can
second?
you can do whatever you want.
In the previous days, we had some Team St. Clair members asking, how do we know if our form that we submitted, how do we know that you received it? So when you submit your form at the very bottom, once you hit the button to submit, there will be a small line that says your form has been submitted. So that is how you will know your form has been submitted. If you happen to have entered any wrong information, it does give you that opportunity there to say, I need to edit my form, or you can fill out another form.
Right.
So I know some people had asked about how do we know if they've received it. It will say that at the bottom of the page.
Good. You can interject anytime you want to. So we appreciate everybody joining us today. And like I said, that we're heading in the right direction. The numbers were looking good today. Let's keep that trend going, and we can only do that by working together. As we have said all along, we can all be a part of this solution, and we're all showing that we can do it. We can get this done. and we can get this vaccine into everybody who's wanting to take it and get back to some sense of normal, boy, we can't wait for that day to come. We'll be back in just a few moments with Daisy to translate this into our Spanish communities, and then we'll be back tomorrow for day 308. Everybody have a good evening. Thank you.
I was born and raised in East St. Louis, St. Clair County, City of Champion. We band together like family on picket where the Mary Brown Center in Lincoln Park was my playground. Just as we were together then, we must all band together now and work to combat COVID-19. As an Olympian, I understand the importance of teamwork and overcoming hardship. So I plead with you to do what I'm doing to fight this virus. Wash your hands, wear your mask, watch your social distance. It takes teamwork, and if we stick together, we will victoriously cross the finish line.